Bowel changes in older adults. Etiology and pathogenesis of TCM, for constipation with recommendations on tea and soup. In terms of TCM, young people suffer from constipation, mainly due to intemperate diet, if a fried, roasted, greasy, or pungent food is taken frequently. Heat will be accumulated in stomach and intestine. Intestinal heat will burn out the moisture in intestinal wall, making the stool dry hard, and then induce constipation. Older adults suffer from constipation, mainly due to an advanced age, or a body depletion after falling ill, which causes Qi deficiency, or blood shortage, to induce some symptoms, such as tachypnea, or anemia. From the theory of TCM, when blood deficiency occurs, intestinal tract cannot be supplied with sufficient nutrients, and thus, reduces the activity ability of large intestine. When Qi deficiency occurs, impetus becomes weak, so the large intestine lacks the force to impel food residue through intestine, and the force for defecation is also greatly reduced. On the other hand, at a Yin deficiency, constipation can also be caused. As older adults should first know, Yin deficiency means a deficiency of fluid, moisture, in somatic cell to make the intestine not water moistening but become dry, and overabsorb the moisture from digested food, to make the stool dry hard, and difficult for defecation. As another cause of constipation in older adults, Yang deficiency means that Yang Qi of kidney declines in older people, which makes intestinal tract lose a warmth, and easily produce a cold, and also slows down the metabolism, to prolong the defecation time. In addition, older adults are more anxious, or over-deliberated to impair spleen and stomach, so that the nutrients absorbed by gastrointestinal tract from food cannot be effectively transported by spleen to large intestine, which influences the activity ability of large intestine. Moreover, at a frequent sitting but less walking, the breath becomes shallow to attenuate the force of Qi flow, which is prone to cause a stagnation of liver Qi, and then abate the volume of Qi flow in whole body, so as to influence the stool impetus of large intestine, and thus cause a constipation. The affected site of constipation is large intestine, and the constipation is closely related to spleen, stomach, liver, and kidney. TCM treatment of constipation is based on syndrome differentiation. In clinical practice of TCM, the condition of constipation is diagnosed by differentiating a syndrome of deficiency, excess, cold, and heat. The constipation in young people is mainly a syndrome of excess and heat. The constipation in older adults is mainly a stagnation of liver Qi and a syndrome of deficiency. Its relevant clinical symptoms are shown as follows. Constipation with stagnation of liver Qi. If older adults are in low spirits for a long time, or at a frequent sitting but less walking, the breath becomes shallow to attenuate the Qi flow in body, which is prone to cause a stagnation of liver Qi. The following symptoms occur: basation, dry mouth, and cold limbs. Tea, aromatic tea of dispersing stagnated liver Qi and regulating Qi flow can be drunk. For example, 6 to 9 grams of rose or osmanthus is added into 250 milliliters boiled water. If older adults are worried that scented tea is too cold and cool, Schuengren tea of Semen Cassii and Fructus cannabis is suggested. Fructus cannabis is of mild nature, and Semen Cassii can clear liver fire. Since they both contain fatty oil, their combined use can make a dryness moistening and bowel relaxing. This tea is very suitable for older adults. Soup, chayote, carrot, pork or beef tendon are stewed. Chayote and carrot are both a food of high fiber. When the residue is taken together with soup, bowel movement can be better promoted. Constipation with syndrome of Qi deficiency. The symptoms generally include pale complexion in ordinary time, defecation intention but with a forced or weak defecation, and occurrence of shortness of breath or sweating after the forced defecation. Principles of TCM treatment: Qi invigoration, Qi flow regulation and catharsis. Tea of Qi invigoration is recommended. For example, 6 to 9 gram radix pseudostellariae is added into 250 milliliters boiled water. When the temperature of tea becomes suitable for drinking, 0.5 to 1 teaspoon of honey is added, which should be cautiously used by people with diabetes. Soup: 30 gram radix astragalli, 30 gram radix cotinopsis, pig trotter or beef trotter are stewed. Radix astragalli is an essential TCM medicine for Qi invigoration. Radix cotinopsis can invigorate Qi and promote fluid production, so that a force is gained for defecation. Constipation with syndrome of blood deficiency. The symptoms generally include poor sleep, amnesia, lusterless complexion, light-colored lip, dry hard stool difficult for defecation, and occurrence of palpitation and dizziness after the defecation. Principles of TCM treatment: primarily blood nourishing and moistened catharsis. Secondarily, a small amount of medicinal material of Qi invigoration and Qi activation. Tea: 4 to 6 pieces of Chinese black dates or Chinese red dates, and 6 to 9 gram radix pseudostellariae are added into 250 milliliters boiled water. For the people with diabetes, Chinese red dates can be replaced with radix rhamaniae preparata. Soup: 15 gram Aurellus longan, 30 gram radix angelicae sinensis, 30 gram radix astragalli, pork, black bone chicken, or scapula are stewed. Radix angelicae sinensis is a common TCM medicine for blood replenishing. It can also make a bowel relaxing and intestine moistening. As said in the basic theory of TCM, Qi is the commander of blood, and blood is the mother of Qi. In other words, in order to generate blood, the activity of Qi is required to produce an energy and dynamics. When Qi in body is vigorous, blood can become sufficient. Therefore, in order to treat the constipation with syndrome of blood deficiency, the medicine for Qi invigoration should also be added to make blood get Qi and then become vigorous. Radix astragalli can invigorate Qi and promote blood production. It is an indispensable medicine in the decoction of blood replenishing. Constipation with syndrome of yin deficiency. In fact, yin deficiency means a deficiency of body fluid, that is moisture. The symptoms are often a dry hard stool like a twig, and difficult for defecation. They may include vexation, tidal fever, dry mouth, or soreness, and weakness of waist and knee. Due to the moisture deficiency inside body, anal orifice is lacerated at the forced defecation to cause a bloody stool. Principles for TCM treatment: kidney nourishing, yin benefiting and moistened catharsis. Tea: 6 to 9 gram radix rhamaniae resins, 6 to 9 gram radix scrofulariae, and 6 to 9 gram radix ophiopogonus are added into boiled water. These three medicinal materials are sourced from Zhengli decoction, an ancient prescription of TCM. In ancient books of TCM, the constipation with syndrome of yin deficiency is described as if a boat cannot sail without water, that is, the moisture in body is so deficient as to not moisten large intestine, which causes a dry stool difficult for defecation. Radix scrofulariae can make a toxin removal and dryness moistening. Radix rhamaniae resins and radix ophiopogonus can make a nourish yin and promote fluid production. Through their combined use, large intestine is moistened to make an easy defecation, and thus increase water for boat sailing. Soup: 30 gram radix adenophori, 30 gram Rhizoma polygonati odorati, 30 gram Trimella fusiformis Burke, and black bone chicken are stewed. Radix adenophori and Rhizoma polygonati odorati can nourish kidney. At arid climate in the autumn, moisture in body is prone to become deficient, which causes a deficiency of body fluid. Therefore, the constipation can be more effectively prevented through this tea. In addition, Trimella fusiformis Burke is rich in fiber which can facilitate the bowel movement. constipation with syndrome of Yang deficiency. The symptoms generally include not dry stool or wet soft stool, but difficult for defecation, cold in extremity of limbs, and more frequent urination. They may include numbness and insensitivity of knee leg. As generally thought by TCM, with a gradual increase of age, kidney yang declines progressively, with an invasion of external cold pathogen. Yang qi is impaired to make large intestine lose warmth, and thus cause a weak transmission. Principles for TCM treatment: yang warming and catharsis. Tea. For older adults, the tea of dried ginger and Chinese red dates can be drunk in the winter. They are both of warm-hot nature, which can make a spleen warming and cold dispelling. However, the following aspect should be noted. Due to the hot nature of ginger, capillary in epidermis is dilated to make people feel warm. But in fact, the medicine of warm nature such as ginger can dissipate the heat in body. Thus the tea of ginger should be drunk by older adults upon wearing more clothes for heat preservation. Diet. For older adults, steamed egg with Allium tuberosum rudel is recommended. Allium tuberosum rudel is of pungent flavor and warm nature which can nourish kidney yang. Soup. 30 gram Radix morinda officinalis, 30 gram Cortex euchromiae, pigeon, or mutton are stewed. Radix morinda officinalis and Cortex euchromiae are common TCM medicine for tonifying kidney yang. They can make a kidney warming, yang strengthening, and bowel relaxing.